Medicare doesn't make any sense. So here at Healthcare Solution Direct, we're going to make this as simple as 1, 2, 3. This video is going to address something that at the end of the day is one of the biggest concerns for those that are going on to Medicare, whether they fall into getting Medicare automatically or if they fall into the category of having to go ahead and apply for their Medicare. For those that have to apply for their Medicare, there's a lot of stress that goes with that, so we're going to recommend that you call us here at Healthcare Solution Direct to make sure that you're doing the right thing. But let's talk right now about the 2 ways in order to be able to get the Medicare. So who gets the Medicare card in the mail automatically? So if an individual is getting their retirement benefits from Social Security or the Railroad Retirement Board at least 4 months prior to them turning 65, the individual automatically receive their Medicare card in the mail. There's nothing that they need to do to apply for Medicare A and B. So again, if you are turning 65 years old and you're receiving Social Security benefits at least 4 months prior to turning 65, there's nothing that you have to do. You are going to get your Medicare card automatically in the mail. So this will also apply to someone that's receiving Social Security Disability Insurance, SSDI. There's nothing that they need to do in order to apply for their Medicare because it will be automatically mailed to them at least 3 months before their effective date. So let's talk about what to expect in the mail from CMS. A lot of individuals are not told exactly what to expect or what to look out for. The individual will receive a letter in the mail from the Centers for Medicare and Medicaid Services with their Medicare card enclosed. Currently, the front of the envelope says Department of Health and Human Resources, and the back will say official information from Medicare. So if you get an envelope in the mail that says on the front, Department of Health and Human Services, Centers for Medicare and Medicaid Services, and the back of the envelope says official information from Medicare, that's your Medicare card. Do not throw that away. It is not a laminated card, it is a paper card, so there's no weight to it. Unfortunately, we've seen a lot of individuals that have actually thrown it away, not realizing that this is actually their Medicare card. They thought it was some junk mail, and unfortunately, that caused some delays in getting their Medicare card back. We'll talk about exactly what to do on that in a future video. The Medicare Part A and Part B card that's enclosed in the paper card does not obviously carry any weight to it, so it's not going to look like a credit card. So unfortunately, again, here's the advice to you is this: make sure that you're looking at your mail very, very closely because it could be your Medicare card that's actually enclosed in one of the envelopes. So inside that envelope, the Medicare card that's enclosed in that envelope from the Centers for Medicare and Medicaid Services, it's going to have a unique Medicare number on it for you, the individual. It's going to also clearly show when the Part A and Part B effective dates will be for you. So again, if you're turning 65, your Medicare Part A and Part B effective dates will be the first of your 65th birth month. Remember, if you're turning 65 and you're born on the first of the month, you're one of the lucky ones. You actually get your Medicare started on the first of the previous month. You get this started before anybody else. So the individual will need that unique Medicare number in order to sign up for a Medicare Advantage Part C plan. So remember, you have to have Medicare A and B in place, and you have to have that unique number in order to go ahead and enroll into a Medicare Advantage plan. Once you're in Medicare system, at that point you can make the choice whether to keep your Medicare or decide to go with an alternative plan with a Medicare Advantage plan. So again, the Medicare card arrives 90 days prior to the effective date. So an individual that's turning 65 and automatically enrolled into Medicare should expect to have that letter with their Medicare card at least 90 days prior to their Medicare effective date. If you do not have your Medicare card in the mail by the 90th day before your 65th birthday, here's what you should do. Pick up the phone and call us here at Healthcare Solution Direct because we will actually show you exactly how to get that Medicare card immediately, where you can go ahead and print that off through your mymedicare.gov account, but also you can request your Medicare card be sent out again to you through the mymedicare.gov account. So again, that's what we're here for, is to make this all simple as 1, 2, 3. So Medicare Part A and B will go into effect again on the first day of the individual's 65th birth month. Again, if the individual happens to be born on the first of the month, their Medicare will start on the first of the prior month. So again, we talked about this example before. If someone's turning 65 on July 1st, that's their birthday, July 1, their effective date for their Medicare would be on June 1st. Their Medicare card would be mailed out to them. They'd receive it 90 days before that June 1st start date. So Now that you understand who gets Medicare automatically, let's talk about the biggest problem with Medicare right now is how someone enrolls into their Medicare when they're not receiving Social Security or Railroad Retirement Benefits or SSDI payments. So if someone's not receiving their benefits from Social Security or the Railroad Retirement Board at least 4 months prior to turning 65, that individual will need to apply with Social Security or the Railroad Retirement Board in order to get their Medicare card. Remember, it's not automatic. Those that are diagnosed obviously with end-stage renal disease, ESRD, that have met the requirements of eligibility for Medicare will also need to apply with Social Security or the Railroad Retirement Board if they're not receiving receiving a Social Security benefit. So again, if you're not receiving Social Security benefits or Railroad Retirement benefits prior to turning 65, at least 4 months prior to it, you must enroll into Medicare Part A and Part B. A question that we'd often get here at Healthcare Solutions Direct is, why do I need to sign up for my Medicare at 65? The individual must enroll in Medicare when they're not receiving their benefits from Social Security or the Railroad Retirement Board because the federal government does not have a means to automatically deduct that standard Part B monthly premium of $148.50 in 2021. So that individual must request their Medicare card, and they're going to need to set up a payment plan for that standard Part B monthly premium of $148.50 in 2021. So the best way to enroll into Medicare is by applying online through Social Security at ssa.gov. I would recommend that you give us a call here at Healthcare Solutions Direct. Our client experience group will take the time to walk anyone through the online steps in order to ensure the enrollment is successful for you. So they understand that this can be extremely stressful for someone enrolling for the very first time, and they will hold your hand virtually through the process over the phone to make sure that you're doing it the right way. But let's talk about the steps to enroll into Medicare when it's not automatic at 65. So an individual needing to enroll into Medicare Part A and or Part B many times are not given the clear instructions. There's really no clear instruction. That's going to be changed right now through this video. You're going to understand a clear instruction and a path of what to do when it comes to signing up for your Medicare. So we're going to go through this step-by-step process on what you need to do in order to successfully enroll into Medicare and apply online. So Social Security, remember, handles the enrollment cards for Medicare. The first place the individual needs to go is ssa.gov to begin the enrollment process. So the first thing, you have to go to ssa.gov. So in order to enroll into Medicare, the individual will first need to log into or create an account through Social Security called My Social Security. So My Social Security account is a free and secure account that will help to identify that the individual is eligible for Medicare Part A and Part B. The benefit of My Social Security is the individual can log into their account anytime and request a replacement Social Security card, check the status of a submitted application, and manage their benefits. So if you're watching this video right now, I would recommend that you create a My Social Security account. This is available to everyone, no matter what your age is. You can sign up for a My Social Security account, so you're able to go ahead and view your Social Security payments. You can view what your benefits are going to be here down the road. So again, my recommendation is go ahead and set up a My Social Security account right now if you don't have it. I have one on myself that's already in place, so I can go in and view my benefits with Social Security and see what disbursements will be down the road for me. So again, I recommend that you do that. So once an individual has their login information for their My Social Security, or they've created their personal account, they will now be ready to begin the process of enrolling into Medicare for their Part A and or Part B. So on the very front page of Social Security, the individual will select Medicare enrollment. So on the very first page of Social Security, you're going to select Medicare enrollment. What will happen next is the individual will then be directed to the Medicare benefits page, which will explain to them the parts of Medicare. The individual will want to scroll down to the middle of the page until they see a big blue button. You can't miss it. It says Apply for Medicare Only. Go ahead and click on that button. It's going to take you less than 10 minutes to go ahead and complete your application. So for an individual that's holding off on their Social Security retirement benefits but still need their Medicare Part A and or B, this is going to be the most convenient way to enroll into Medicare. an individual turning 65 will not be required to sign any forms or need to provide any documentation. Remember, during your 7-month initial enrollment period, you do not have to provide any documentation when you sign up for Medicare. What will happen is the individual will be directed to the benefits application terms of service page, where they will agree the statements that they're applying for their Medicare benefits. Once they've clicked on that and they've clicked next, it will take them to the next page. The individual is now ready to apply online for their retirement Medicare benefits by clicking on Start a New Application. Once they've submitted the application, they can always follow up and check the status of their application by signing back into their personal My Social Security account. Let's go through the step-by-step on exactly what you're going to see when you log into your My Social Security. So the first thing is the individual will answer a couple of questions, and then we'll be able to securely sign in through the My Social Security and begin the Medicare enrollment process. When directed, the individual will enter their username and their password and sign in through My Social Security. So once you've actually gone ahead and done that, there's some key questions on the application for Medicare that I'm going to go over. The Identification tab will ask the individual if they would like to apply for Medicare only or for their retirement cash benefits as well. If applying for Medicare only, the individual will answer yes and click on the next button. The General tab will ask the individual if they would like to enroll in Medicare Part B, which again, they will answer yes to. They're applying for Part B. So once the individual has reviewed and electronically signed the application, they're going to get a thank you for applying for Medicare online. The application is now complete. It's pretty simple. The individual should receive an email confirmation once they've submitted the application to Social Security for their Medicare, letting them know that the application has now actually been received for them. So if you need to access the Medicare number online right away, here's what you're going to want to do. The individual will typically receive a letter from Social Security called the Benefit Verification Letter within about 10 business days, showing they were approved for their Medicare. It's highly recommended that the individual log back into their My Social Security under Benefits and Payments and select Get a Benefit Verification Letter. Let me repeat that again. Highly recommended that the individual log into their My Social Security under Benefits and Payments and then select Get a Benefit Verification Letter. They can then print this letter with their unique Medicare number and effective dates so they have it right away. Because it's going to take about 3 to 4 weeks to get the Medicare card in the mail, so this will be useful by having that unique number right away, because at that point, if you're wanting to sign up for a Medicare Advantage plan, you can do it with that unique number on the benefits verification letter. So if an individual is applying during a special enrollment period, they should also apply online through Social Security. On the front page of Social Security, they will select again Medicare enrollment. They will scroll down now to the middle of the page where it says already enrolled in Medicare. So if you're looking to do an SEP, a special enrollment after 65, you're going to want to click on already enrolled into Medicare because you've already had your Medicare Part A. The individual will then select apply online for Medicare Part B during a special enrollment period. The individual will then be directed to the Medicare Part B enrollment during a special enrollment period SEP. They will fill out the form CMS 40B, application for enrollment in Medicare Part B medical insurance. And in the remarks section, because you can do that all online, fill it out online. And in the remarks section, say, I want Part B coverage to begin the month and the year in the comments section. The form CMS L564 that the benefits specialist filled out from your company can now be easily uploaded during this application process. So you'll fill out the CMS 40B form yourself, very easy. In the remarks section, you'll say when you need your Medicare to start, and then you'll upload your CMS L564 form that was filled out by the benefit specialist. So an example of the CMS L564 form that the benefit specialist must fill out for the individual can be received by calling our office at Healthcare Solution Direct. Give us a call. We can go ahead and email that to you right away so that you have that ready to go for your special enrollment. We're looking forward to your call to be able to help you out with that process. So during the online application for the special enrollment, once the application has been submitted electronically to Social Security, the individual will get an email which they will need to confirm their email address. So once you've submitted the benefit letter from your employer and you've completed the application, you're going to get an email from Social Security that's going to ask that you confirm your email address. Once the email has been confirmed, they will get another email confirming that everything has been signed and completed. Guess what? You are now fully complete right now in signing up for your special enrollment period.